So the Ministry of Health and Wellness is advising that it will immediately implement the World Health Organization's recommendation to administer an additional dose of the COVID-19 vaccine to Jamaicans who are classified as immunocompromised. Here to discuss and share some useful information is the Chief Medical Officer, Jacqueline Bisesa McKenzie. Good morning, hardworking Doc. How are you?
Morning, Delia. Morning, Neville. Morning to your listeners.
Yeah, man. Morning, Doc. Great to have you with us. That word that Delia just used, what does that mean? Immunocompromised. What does that mean?
Okay, so we're referring to persons who would not have mounted an immunity, an immune response after they've gotten the first 2 doses of a 2-dose vaccine or 1 dose of the 1-dose vaccine. So what happened is that there are some people, whether it is because of their illness or because of medication that they're on, it suppresses their body's ability to mount a response. And so they may require a bit more in order to get them to mount that response that we want that would protect them from COVID-19 disease.
Mm-hmm. It might be a long list, but just for ease of reference, who would those persons be? What are some of the illnesses that we'll be looking at?
Okay, so we're looking at persons who have active cancers, and these can either be solid tumor cancers or blood cancers, as we call it. If they're on treatment, some of them are on chemotherapy, or if they're within 12 months of having completed their treatment, they would still be considered to be suppressed, and so therefore they would need a booster. Not a booster, an additional dose. And I have to explain that to you. But let me finish the list. You have transplant patients, persons who have immunodeficiency disorders, persons on chronic dialysis, persons with HIV with a CD4 count of less than 200 cells, and persons who are on immunosuppressants like high-dose steroids or other immunosuppressive drugs, methotrexate being one of those that is commonly used, but there are several others, persons that are on chemotherapy or radiotherapy.
Okay.
What's the difference now between the booster and another shot?
Right. So this is an extension of what we call the primary series. The number of doses that have been found in studies that allows you to mount an adequate response is called the primary series. And so most persons will mount an immune response, and then that will deplete over time, sometimes months, sometimes years, and then they would require a booster to give them that additional push to have that immune response still remaining strong. Mm-hmm. But then you have some persons who do not mount the response. And these persons, therefore, would not have satisfied what we want the primary series to do, which is for them to mount a response. So they need an additional dose. So they need that extra dose in order for them to mount the response. Persons who get boosters have mounted a response, but over time, that would have decreased, and then they need that booster.
Okay. The World Health Organization is recommending, I'm told, Doc, that the additional dose should be given within a certain time frame.
Yes.
So for those persons who are immunocompromised and probably got the AstraZeneca earlier on in the year, then it means it's important that they have to get it now, because that time frame may have passed already. Will that affect the way that the drug works?
No, it will not affect the way in which the drug works. The recommendation is between 1 to 3 months, and that would have been put out on the 26th of October. Mm-hmm. So many persons would have passed that time, but it is not too late. They can get it. I mean, there have been various studies that have shown different time periods that it would be good for persons to get these additional doses. But overall, having reviewed those studies, the advisory committee to WHO would have come up with this time period. Yeah. It is not too late. If you have gotten your second dose 2, 3, 4 months ago, still go in to get your additional dose now.
You explained it just now, but forgive me. So the booster shot and a third vaccine shot is not the same thing going into your body?
It is the same medication, yes.
Then
But
why?
let me try again, Neville. Let me
Yeah.
try again. When you get vaccines, the vaccines are aimed at for you to get a response.
Right,
And if it is that it takes one vaccine for you to get that response, then that is your primary series.
right.
If it takes two vaccines for you to get that response, then it's a 2-dose vaccine, and that's your primary series.
Okay.
So for what we have found, or what the studies have shown, is for the persons that are immunocompromised in these groups, it takes more than the 2 doses
Okay.
for them to get that response. And so they need that additional dose. And so for a 2-dose vaccine, for them, the 3-dose would be that primary response.
Okay.
Other persons would have taken the 1 dose or the 2-dose, and they mount a response. So the 1 dose of a 1-dose vaccine is adequate.
Right.
And the 2-dose of a 2-dose vaccine is adequate, and because they mount the response that is required. Now, you would know for many of the vaccines that we give in childhood, for the childhood disorders, over time, maybe it is 6 months, a year, sometimes years after, we give a booster, because although they have mounted a response, it depletes over time, and then they need a booster to boost you, to push you up, to make sure that the response remains strong.
All right. That third shot, would they need another one after that? Or you're not certain about that, or is just 3 they're going to need, or what?
Well, we have seen, the recommendation is not out yet, but certainly we have seen the results of studies that have been published that suggest that, yes, that these persons would require a booster. Some studies are showing that maybe 6 months, a year later.
Okay.
But we would await the recommendations on the boosters for those persons, as well as for the other persons who would have received their primary series.
Okay.
So, Doc, I'm hearing 2 things. I'm hearing that it's important for us to know whether or not we are immunocompromised, but also that we have to get in touch with our healthcare providers, because I don't think you can just turn up and say, hello, I need an extra shot. Do they have to get a letter from a medical professional? How will the process work?
Okay, so how will we know that you fall into that group when you present and say that, yes, I have cancer, and therefore I should get this additional dose? We do require that you present the verification of that from your physician that is treating you, because all of these persons would be in groups that are being treated. So they present to their vaccination site with that letter that serves as proof that, yes, they are in that group. But as you know, we have rolled out the vaccine administration to many of our private practitioners. And what we are encouraging is that there are doctors who treat a large number of these patients. For example, our patients who are on chronic dialysis, they are being seen by the nephrologist. Persons who have cancers, they're being seen by the oncologist. There are many specialists that are treating large groups of these persons. And we would like for these doctors to reach out to the health department to get the doses so that they can administer it to their patients, because many people would feel safer, more secure. They know they're sick already, and they have their doctor who is saying, this vaccine is, you're to get an additional dose, and here it is. What are the possible issues and stuff that, they would need to know.
Yeah.
So that is one way as well that we think that many persons will choose to get vaccinated through their private practitioners.
Dr. Bisesa McKenzie, I was saying to Daly, I read that the Vice President and the President of the United States got booster shots. What about the average Joe, hopefully like myself, who don't have any of these illnesses that you suggested? Do we need booster shots? And if so, when do we get them, if we need them at all?
Okay, so the information, changes almost on a daily basis. And I expect that recommendations will come out from the WHO shortly where this is concerned. I think the global thrust is really to get persons at least to have some protection with a 1 or 2 dose, vaccine, and that is where the priority lies. But we have seen that the recommendations from the manufacturers of both Pfizer and Johnson & Johnson coming out of the US, they would have made their recommendations to that regulatory authority and have been given the approval for that booster shot, which is for those persons who have mounted a response, but now they're given an additional dose in order to increase their response. So, and we have seen other regulatory authorities in the UK as well as in Canada that would have now put in place the booster shots for those vaccines. For AstraZeneca, that most of our persons or population would have received, the recommendation has not yet come from the manufacturer. And this is because, the reminder is always that the vaccines protect against the severe illness. And there still remains that immunity. Persons are still shown to have high protection against severe illnesses and hospitalizations. And so therefore, the manufacturers for AstraZeneca have not yet said that a booster is required because there is still strong immunity. And you see, you run into the problem that if you say a booster is required at 6 months, and then studies show that the immunity, you have strong immunity until 9 months, then the recommendation may come out that it's as 9 months that you need it, or it may last for a year because, the vaccine is still new. So they are doing ongoing studies to see the level of protection and how long that protection lasts.
Okay.
So the vast number of persons would have received AstraZeneca, and we are still waiting to see what will be the guidance in terms of the timing of that would come from the manufacturer as well as from the WHO. But we recognize that several countries have gone ahead, including some of our countries within the Caribbean territory. Many of the persons that would have received AstraZeneca would now be at their 6 months in November because their second dose would have been in May. For Pfizer, for us, our doses, we started in August, and we would have given the second doses, most of them just now being given. So we still have a period of time before that 6 months period.
Okay.
And for Johnson & Johnson, the recommendation that we've seen coming out of the FDA and the CDC is about 2 months for that booster. So we are just there. So I would say that over the next couple of days, maybe weeks, we will see the recommendations coming out. If it is that we are going to put in a policy perspective for boosters, of course, we have to ensure that we have the medications to be able to give the medications to persons at the times that they need it. Okay. And right now for Pfizer, really and truly our priority is to get as much persons protected, because we know that after the first dose, you have a high level of protection. And after the second dose, you have an even higher level of protection. And it's more important for us to get those doses into arms than to be thinking about giving a third dose at this time. And for the AstraZeneca, we know that we still have strong levels of immunity that persons have that protects them against severe hospitalizations. So in time, we will see the changes. We're not in any danger at this time. So I want to reassure the population that yes, the recommendations may change over time, but at this time, get your primary doses, your 2 dose of a 2-dose vaccine and your 1 dose of a 1-dose vaccine. You will have a good amount of immunity, and it certainly will protect you against severe disease, hospitalizations, and deaths. And that is what we are seeing in the patients that we're seeing that are presenting to hospitals. 98% on average of persons that are in hospitals are unvaccinated.
All right,
So
Doc,
we're
we have It's so important what you're saying. I feel so bad to have to say we have to
we have to
go,
go.
but we do have to go. It's always such a pleasure to speak with you. I know you're extremely busy, and we're grateful that you took the time to walk us through this morning.
So, Delia, just one thing, people
Yes.
who are due their second doses, they must come out and get their second doses. We have a lot of people that are due that have not come out as yet. They need to come out and get their second doses.
Thank you. Thank
Belated
you so much.
happy birthday, ma'am. God bless you. Stay safe.
Thank you.
Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie.
Coming up, we talk about activating your creative superpower.